Welcome to another edition of Survival Stuff with Indiana Jim, sponsored by Live Free USA at AmericanSurvivor.org. I am James C. Jones. I write a lot of books about survival. I do some presentations, but Indiana Jones was taken apparently by Harrison Ford, so I have to be Indiana Jim. Live Free USA is America's oldest and most respected survival organization, established back in 1968 to promote and educate and help people become more prepared to handle emergencies, of which we are having more and more every year. We are a nonprofit, tax-deductible organization supported by memberships and contributions only. I would certainly welcome having you join. We'd welcome having you make a contribution, because that's what keeps us going. I do find it interesting that, considering the situations that we have today, that we are the only organization, nonprofit organization, in the business of promoting self-reliance and home survival. But yeah, today I want to talk about oxygen. Now, I used to be an EMT, and I went through a lot of training. I actually was a trainer myself for a little while. But oxygen, the first thing we would do, roll up on a scene, whatever the situation was, two things we want to do. We want to put an IV in, and we want to get an oxygen mask on them. Hopefully 15 liters per minute, by full non-rebreather mask if it was serious, or sometimes we just put the little nasal cannula on, and maybe 3 liters per minute just to give the person a little boost in oxygen. But oxygen was really important, and hydration and fluidization was very important. The IVs are a real problem, and because most people aren't going to be trained or have the equipment to do IVs. There is a kit out there that you can get, that you can learn about how to do an IV. It's by the I forget what the exact name of the company is, but it's a nice kit to learn how to do that. But I'm going to talk about that today. I may talk about it another time. Nevertheless, what I'm going to talk about to you today is about the oxygen part of that, because lots of times this person has a low blood oxygen level. Blood oxygen levels should be maintained between 75 and 100 mm's for mercury to prevent hypoxia and death, which hypoxia is a condition where you don't have enough oxygen in the blood. It can cause by a wide variety of conditions. Low levels of oxygen are usually anything below 21% of oxygen breathing in. That's what we get. The air around me right now is about 21%. Anything below 19%, I used to do confined space entry stuff, and we'd check the oxygen levels all the time. If it was below 19%, everybody had to get out because there wasn't enough oxygen in the air, because your body takes in the 21% oxygen, and it uses a little bit of that oxygen and breathes the rest of it out. But when it gets down to 19%, it doesn't have enough oxygen to pull out of that, the air that you're breathing. Carbon monoxide, which of course you're all aware of, carbon monoxide basically looks like oxygen to the cells. So the carbon monoxide goes into your blood, it locks up those cells where they're supposed to, receptors that are supposed to get oxygen, and then oxygen can't get into your bloodstream. That's a very dangerous condition, and we talk about that when we do our medical classes about people with carbon monoxide. So if there's a danger of carbon monoxide, if more than one person has got a headache and is sick in the same room, or they're fine when they go outside, but an hour later they come back in, the carbon monoxide is probably the danger. Anytime where there's a fire, we hear people running generators either too close to their vents, or actually inside their house, or inside their attached garage. That's where you get carbon monoxide. So that's another area where a low oxygen level is a problem. Pneumonia, COVID-19, ARDS, and other respiratory infections, which we're seeing all over the place now. Again, the lungs fill up with fluids and they get problems getting enough oxygen. Eventually you get into pneumonia, and then you've got a problem, you need oxygen. So again, for EMTs, it's like, well, So just give them oxygen just in case, and we'll find out what's the problem is later, but right now, oxygen never hurts, okay? Now, there was an old psychology, that years ago, where if you gave somebody that had COPD too much oxygen, their breathing drive would shut down. But in reality, that seldom if ever happens, and definitely not in the short term. So pretty much oxygen is one of those things like fluids that you really can't go wrong by trying to give them some. Now there's exceptions to the fluids one, which this is another subject entirely. Smoke inhalation. Person comes out of obviously a burning building, whatever, especially in these disaster situations. Smoke inhalation, stuff they're coughing or wheezing or whatever. The amount of oxygen you can get in that person is very important. They're definitely going to have problems. They may have even, burned lungs or damaged lungs. So again, oxygen becomes important. Severe bleeding and shock. Yes, it's not an oxygen problem, but when the blood pressure drops down and you have severe bleeding, the more oxygen you can get into the blood that's still there, the better off you are. COPD, which I mentioned, COPD, chronic obstructive pulmonary disease, especially for people who smoke, but other people get it too. Their chests are inflated, and they breathe with their mouth open. This kind of COPD situations. Again, their blood oxygen level will be low, and they may be having other medical problems because of that. Cardiac arrest, of course. They're going to need oxygen, but if they are in full arrest, obviously giving them oxygen is not going to help until you initiate CPR and you get them breathing again, you get their lungs going again. But if they show the signs of a heart attack, the chest pain, the left arm pain, the jaw pain, difficulty breathing, sweating, all those kind of things, that seem to indicate that they may go have a heart attack. Again, giving them oxygen would be put them ahead of the game because their circulation from the lungs to the heart and the lungs to the heart is not what it should be. And the more oxygen, the higher oxygen level in the blood, the better. Respiratory arrest, to stop breathing entirely, of course, this is another thing where obviously you're not getting oxygen. Now, as I said, as EMTs and paramedics, the first thing we're going to do with 15 liters per minute, we're going to put full oxygen on them. The first thing you should always do, regardless of, is to call 911 and then do whatever you can. Now, what are the signs of low oxygen? Okay, we know what the kind of causes can be, but what are the signs and symptoms of somebody that needs oxygen? Well, obviously shortness of breath, where they're having a difficulty breathing. Sometimes they'll say, I can't breathe, You see it on ER programs and on TV, they're like, I can't breathe, boom, they put the oxygen mask on right away. Bluish or pale skin is another one. Headache, severe headache. Sometimes somebody's drunk or so whatever, and they get a severe headache. Those actually is kind of an oxygen level problem. Severe headaches, restlessness, especially if you're going to shock. They think they're going to die and are kind of acting kind of crazy because, again, they don't have enough oxygen. Dizziness, obviously. Rapid respirations. Their system is trying to readjust their oxygen carbon dioxide levels. It does that by trying to make an adjustment. Rapid respiration. Confusion, obviously if you don't have enough oxygen to your brain, it's confusion. High blood pressure sometimes, lack of coordination. We all know, somebody's not enough oxygen, they start to wobble. Visual distortions, when things are out of focus. Rapid heart rate, their heart again is trying to, what they call compensate for things like that. Euphoria, in some cases people without enough oxygen actually get dopey, start acting silly. All of those are potential signs of lack of oxygen. Now here's the problem, okay? Here's the problem is that for whatever reason, high flow medical oxygen requires a doctor's prescription. Our EMTs, paramedics that have that on the ambulance, people that have COPD or whatever, they get a prescription and they can pick up their tank and go home with that. But these old laws are kind of out of whack at this point, because usually I was trying to get high flow oxygen for the factory that I was in charge of, and I had to go and finally got a company doctor to give me a prescription so I could keep 15 liters per minute full oxygen tanks in the plant. Because the old philosophy was that anything above 3 liters per minute, you could cause a problem. That's old thinking, okay? So anyhow, what are we going to do? We do want to give a person oxygen. Oxygen can be literally a lifesaver. And I stumbled upon this kind of easy answer. They have these tanks. I actually got these online. But you can also, a couple weeks later, I was at Walgreens and I saw a whole rack full of these things. This stuff here is not high flow oxygen, okay? It's medical oxygen. It's medically safe oxygen in a little disposable can. This doesn't weigh much, which is, I can tell you that the big oxygen tanks that they use in the ambulance are pretty heavy. This doesn't, because it doesn't have a lot of high pressure oxygen in it. But it has oxygen, breathable oxygen in a tank. Now, why are these out there in the first place? Well, the college kids who got to study all night, they want to cram for an exam, okay? That's one of the uses. They'll suck oxygen from time to time to keep themselves awake. And, people who drink too much or get drunk and then they got to go to work the next day or they got to go to school the next day, yeah, they're using this too. Because again, those kind of things lower your blood oxygen level and you can be undrunked, or at least somewhat more sober if you suck some oxygen from one of these tanks. But these I would highly recommend you have, if you can't get your hands on grandma's medical oxygen and maybe the regulator and all that kind of stuff, or learn how to use it, which you may not be able to do because you're supposed to have a prescription. You could get several of these and somebody starts showing signs of a heart attack. Somebody starts showing signs of a stroke. Somebody's having difficulty breathing, going into shock. Any of those things, not only is it a psychological comforting, but it actually will increase the blood oxygen. And basically, it won't last real long. I haven't actually measured how many squirts you get out of this tank. It depends on how long it's on. But basically, the whole thing is clear in front of your face. In fact, this one's probably a little better. And you just take a breath of oxygen, okay? I feel better already. Well, point is, this is an answer to a primary first aid problem that goes a little beyond first aid, but it gives you access to some level of emergency oxygen that you can have in your home, along with your tourniquets and your other equipment that you have for medical emergencies. Available oxygen right there. Like I say, you can find it at Walgreens or CVS, or you can go online and Google it, and you can buy these tanks. I think this was like, these run $12 to $15, the bigger tanks. They also have a tank about half this size that's about $9, that maybe you could have that to carry with you, be in your kit. These are a little bulky for your survival kit or your medical kit. But anyhow, available oxygen, important thing to have. So, till next time, this is Indiana Jim for Life and Freedom. Stay safe out there.